Pain and fatigue in patients with rare bone diseases. What do we know and what can we do about this?
We know that several patients who have multiple osteochondroma and enchondromatosis have pain, and this can both be acute pain, which is related to the osteochondromas and the enchondromas, or after surgery, for example, but it can also be chronic pain. And in chronic pain, there are some changes in the brain and some sensitization which happens. And when you have chronic pain, it is really important to look at all the factors that are important. And so you have to look at what we call the biopsychosocial factors, and you have to look, okay, of course, the disease is important, and then you have to look at the psychological side, what kind of factors are relevant there, and then you have to look at the life itself, at the social factors, what are relevant there, and then it's kind of the same with fatigue, actually. We know that pain and fatigue, they're like friends, so they often are together. And there too, you have to look at all the factors that are relevant. And then you have to see, okay, what can you change? I mean, the disease is there and you cannot take it away. There's no medication to just take it away. But you have to look, okay, how can you cope with the pain? How can you cope with fatigue? Physical activity is really important, but you have to balance. You have to balance your energy so that you don't use all your energy on the good days, because then you won't have anything again on the bad days. So this is really important, and I think it's really important also to get some help with that. If it's a doctor, a physiotherapist, a psychological specialist, so it's important to look at the whole person. Yeah.
Thank you very much. And how did you learn about this annual conference organized by an Italian association, and what prompted you to attend for a third time?
Actually, I got the newsletter from the air in Bonn 3 years ago. I think it was in February or March, so it was quite late. And I contacted first Luca, and Luca said I could contact you, Liana. And then you said, yeah, invited me to come. And it was such a nice atmosphere. And that's why I wanted to come again, and took with me a colleague from Norway. And then this year we are here again. And it's a good combination of meeting people and learning new things that happens in the world of multiple osteochondroma and enchondromatosis. So that's the combination which is really nice for me. And yeah.
Thank you very much. Thank you.
Yes.